how important it is to get proper rest, how important it is to ensure that we're mitigating our stress levels. Because again, whether you are aware or not of this HPV infection, the reality is that the immune system is aware. The immune system is aware. So making sure that it is able to do its job when you are unaware, that's what this is all about. And how unfortunate it would be for us to then somehow be not as nutritionally optimized as possible, and our immune system isn't as optimized as possible, and then before the infection that we're talking about, all of this quote unquote being unaware becomes our very detriment. So as simple as stopping, smoking, cessation of smoking, uh, enhancing the immune system with proper diet, proper sleep, mitigating stress levels, getting your pap smear, all of these things decreases the risk of developing cervical cancer significantly.
I think to add on to that, I would also say follow up, especially if you were told, hey, this is abnormal. I want you to come back in 6 months. One of the big problems that happened during COVID is, imagine if that 6 months was in April or May or June of 2020. And that test, which, hey, you had an abnormal finding on your pap smear, you don't go follow that up. You have all these other means, safety measures, but the more important point is the follow up, because it's not even just cervical cancer. How many times have you heard? I'm gonna speak for myself. I've heard somebody say to me, "Yeah, they told me my blood pressure was high, but I'm working on it." They never go get their blood pressure checked again. Yeah, they told me I was a borderline diabetic. Well, did you get follow-up blood work to make sure that lifestyle or holistic thing that you're doing is actually having a positive effect on you? And again, back to that preventive mentality as opposed to that reactive mentality. Because how many of us will go to work with a headache? Probably many of us. What if we knew that headache meant that our blood pressure was 200 over 120? That's the setup for a stroke.